Canada is on the cusp of taking delivery of the first vaccine for COVID-19, and it's happening earlier than originally expected. The federal government now says the first doses of the Pfizer BioNTech vaccine could arrive as early as next week. Health Canada hasn't approved it yet. It's still reviewing data from several vaccine candidates, but it could approve the Pfizer BioNTech vaccine later this week. And the Prime Minister said today a deal has been made to get up to 249,000 doses of it delivered shortly after that.
We are facing the largest immunization in the history of our country. This is no small task, which is why we have a clear plan. Pending Health Canada approval, the first shipment of doses is tracking for delivery next week.
That plan depends on preparing 14 vaccination sites equipped with ultra-cold freezers essential to store the Pfizer vaccine. The plan is for every province to have at least one site. The four biggest provinces, Quebec, Ontario, Alberta, and BC, will have 2. Doses will be doled out to the regions on a per capita basis. Though because of the logistical challenges of the ultra-cold storage, the territories won't be part of this initial round of the Pfizer vaccine. The cold chain distribution will play a big role in who gets the Pfizer vaccine first. It's complicated to store and requires 2 doses, and not everyone will get it. The initial 249,000 doses will be enough to vaccinate about 125,000 Canadians. Contracts have been signed for more doses in the months ahead, not just from Pfizer, but from other manufacturers as well. But tonight, Canada is closer than ever to getting this mass immunization program underway. Mercedes Stephenson has tonight's top story.
Today is a great day for Canada and for Canadians.
After weeks of mounting pressure on the federal government about when Canadians would see a COVID-19 vaccine, some unexpected good news.
We can assure Canadians that we will have early doses of the Pfizer vaccine in this country. The light at the end of the tunnel is clear.
The relief in the provinces, clear.
Newfoundland and Labrador is one of the 14 vaccine distribution sites Prime Minister Trudeau just announced. Thank God.
Pfizer will deliver the vaccine to ultra-cold freezers at hospitals and universities across Canada. But it is up to provinces to determine who rolls up their sleeves first.
We just need to, set up the expectations that this is going to be a very limited supply, especially early on, and so it'll be very minimal scope on who we can immunize with it.
At the front of the line in most provinces, the elderly, those working in long-term care homes, and healthcare providers, as well as Indigenous Canadians. But there could be a hiccup. The Pfizer vaccine is temperature sensitive, and it's not clear whether it must be injected at the same site Pfizer is delivering to, or if it could be transported to long-term care homes and other locations.
We're still in discussions with Pfizer to understand whether the doses must be left at that initial place and then people come to where the vaccines are located, or if there is some ability to move the vaccine slightly.
For the vulnerable elderly, that might mean waiting for the Moderna vaccine, which the company says could be ready for delivery this month too. It also means the territories and Indigenous Canadians in remote communities will have to wait.
Might be a focus on urban centres or places where it's more, amenable to having those vaccinations take place. And then as we get more and more doses, we'll be able to offer to more and more Canadians.
Prime Minister Trudeau says the first run will give the country a vital roadmap. Donna, Pfizer and Health Canada are conducting a dry run today that includes dry ice to mimic the procedure and try to sort out any hitches in the plan before the real vaccines roll out.
Okay, Mercedes Stephenson in Ottawa, thanks. Well, administering the vaccine when it is approved and deciding who gets it first is up to the provinces. It's clear the priority will be frontline healthcare workers and the most vulnerable. Quebec, which recorded more than 1,500 new cases today for the 3rd straight day and has more than 800 COVID-19 patients in the hospital, is one of the hardest hit regions, and it unveiled its vaccination plan. Mike Armstrong explains.
The plan is to hit the ground running. Quebec's health minister says next Monday, December 14th, the province will take possession of 4 boxes of Pfizer vaccine, about 4,000 doses. They'll be delivered to 2 sites, one in Montreal and one in Quebec City, And as quickly as possible, the plan is to use those doses to vaccinate seniors in 2 long-term care facilities.
That's really our first test. That's important.
The health minister has been in contact with Pfizer and hopes to have a bigger shipment later this month, 57 more boxes. The province has set criteria of who it wants to vaccinate first, and age is the biggest priority. That means long-term care facilities go first, but as that happens, they're also going to be hitting at least some of the second group, healthcare workers.
We need to make sure we protect the patient, but we need also to make sure that we protect the people that work for them.
Once those 2 first groups are done, Quebec's plan would be to hit isolated communities and then groups based on age, working down, 80 and over, 70 over, and so on. It will be a massive effort, but one the province is confident it can pull off. Quebec's already vaccinating about 250,000 people a week for influenza. It'll be months before there's enough COVID-19 vaccine to get to that rate. Now, Quebec hospitals are starting to be overwhelmed. The Lakeshore General on Montreal's West Island is over capacity and has shut down its emergency ward. The health minister says the province has been operating the healthcare system at about 80% and is cutting that to 50%. That means turning away patients who need treatments and operations. The restrictions in place, including banning Christmas gatherings, are needed.
We don't want to lose the focus despite this good news that we have.
The effect of the vaccine, or getting back to life as normal, is still a long way down the road. But it also appears this good news is arriving as we enter what may be the toughest stretch of the pandemic. Mike Armstrong, Global News, Montreal.